Sometimes people ask me, hey, how did I get this ingrown toenail, and what should I have done to have prevented it? And I think it's important to really notice that the way you cut your toenails is one part of it, but it's not the only part. One of the most common misconceptions about toenails is cutting them square, cutting them rounded, what's the correct thing to do? And it really does depend upon your anatomy. The shape, the size, the amount of tissue, all of those things really make a difference. So we've got this illustration here today to help us. So for instance, this ingrown toenail, you'll notice, illustrates a significant fold of skin or fat that rolls over the toenail, causing the nail to dig in and cut the actual skin or tissue underneath that leads to a bacterial infection and causes a lot of pain. So in this case, the shape of the skin as well as the position of the toenail cause the person to get an ingrown toenail, as opposed to a toenail that grows flat or slightly curved across the top of the toe. When we have a nail with normal anatomy such as this, a rounded cutting of the toenail works just fine. In the case of somebody who has a lot of redundant skin or a lot of fat or a lot of just larger toes with a nail with a lot of curvature, it's important that they cut that toenail a little longer and that they allow the toenail to be cut square across the end so that it doesn't actually create a corner inside of that tissue. It's the corner of the nail where the leading edge and the side edge meet together. When they have that, they're going to get an ingrown toenail if they try too hard to dig inside. So normal anatomy, abnormal anatomy, it really does make a difference. You've got to be able to look at yours and decide, what am I dealing with? People will often get ingrown toenails because of the shape of the way that their toenail grows. For instance, if they dropped a frozen turkey on their toenail and the toenail changed shape and size and color because of it, they may have permanently damaged the root of the toenail, causing it to grow differently. Thereafter, the toenail may get ingrown because that's now the new shape of their anatomy. The other reasons that can happen is that people genuinely do incorrectly cut their toenail. For instance, if they cut off part of it, but they leave a small section down in the corner, they may have left a piece or a sliver or even a sharp pointed edge to that toenail that will cut into the skin that surrounds the edge of the nail. That sharp pointed piece will then cut into the skin and allow bacteria to get inside, causing an infection and a lot of pain.